Hi, this is Dr. Corey Maas on Looking Your Best. I had a patient that came in today who has both chronic, slightly active acne and older acne and chickenpox scars. And she wanted to know the best course of action to improve the texture of her skin, as well as help to prevent the acne that's coming out occasionally. Hormonally is really her main problem with hormonal acne. And really improve the color along with it. So there's some dyschromias, discolorations in her skin and her face that go along with the acne, redness and brown colors that happen after the redness, post-inflammatory hyperpigmentation. And it's a tough question. She came in with a lot of knowledge about fractional laser resurfacing, or some type of laser resurfacing, which is very effective in smoothing the skin texture out, improving the pits or pock marks, the surface irregularities, and the sort of bunched up wrinkling that happens around old acne scars. But fractional laser resurfacing doesn't do a lot for pore size or the gland size where the bacteria live. And thus, we talked a little bit about an alternative and talked about just in general the strategies in acne management. All of them begin with being on a good skincare program. A good skincare program would be something that cleanses the skin, obviously, that helps to keep the pores open and from plugging with debris and dead skin cells, which are constantly working their way to the surface, as well as gentle exfoliation of the skin, which can be done simply at home with a butt puff and a light facial acid wash, or you could go to a spa or salon like the Appearance Care Center and get a beta or an alpha hydroxy acid peel. Those things are very effective in taking those dead skin cell layers away. And typically we like to see patients on retinoids if they can tolerate them, a tretinoin molecule or a retinol type of product, which are good in helping to thin the outer layers of the epidermis, the dead skin cell layers, and thicken the dermal layers, just improve skin functioning in general. Once we assume that we're on the base of the pyramid, that skincare program, we can go to the next level of care. And that next level of care includes, and this is what we were talking about earlier, treatments that can actually reduce the gland's size and thus pore size. And the only one that I think reliably offers that is a treatment that's called photodynamic therapy. Photodynamic therapy, or PDT, can be done in a number of different ways, but the basic premise of it is that we're painting on a product called Levulan, and Levulan is a sun or light sensitizing, photosensitizing agent, and when a certain color of light in the sort of lighter blue or green or spectrums are applied to the skin surface, that activates that molecule and it actually shrinks the glands down and kills the bacteria that have been pre-sensitized by the Levulan. So this is a good way of actually making pore size smaller, killing off the overall bacteria count in the skin, and thus can improve the skin texture and quality just by simply reducing pore size. So in this patient that I talked to, we really had kind of a dilemma in that we have, some choices to make, in that we can treat the pore size and reduce some of the bacteria load and even the outbreaks of bacteria by doing photodynamic therapy, and still we can treat the scarring from the older injuries or acne that she had previously, and do that more with fractional laser. And in the end, really both options seemed a good choice for her. And then we talked a little bit about the order that we do this. Would you rather do photodynamic therapy first, or would you rather do fractional laser first? And my suggestion typically is do the fractional laser first, get the skin smoother and more even. We can come back with IPL and or photodynamic therapy later to get rid of some of the redness in the skin and thus speed the recovery of the fractional laser resurfacing. I've talked about fractional lasers in other videos and other papers that I've written, but the basic premise of fractional laser is that as opposed to the full laser resurfacing done with a sander, dermabrader, or a deep chemical peel, or even full laser, the entire surface of the skin is injured, stimulating a wound healing response that improves the collagen that's aligned, stimulates new collagen formation, remodels the existing collagen, and creates new skin cells that smooth the skin in general. With fractional laser, we're still stimulating that by injuring the skin in a very controlled way, but instead of the entire surface being injured, only a fraction, only small dots of injury are created, and thus we're still stimulating the same process, but the residual skin, the areas that are undamaged, serve as reservoirs for wound healing, and it moves the healing time down from 7 to 10 days with full laser, where the redness after that 7 to 10 days can last for months, to 5 days until makeup, and redness that only lasts for a few weeks to maybe several weeks at most, to slight pinkness that can easily be covered with makeup doing fractional resurfacing. Recovery can be a few days. People with PDT and using a low wavelength filter IPL treatment like what we do, patients are typically pretty puffy for the first couple days and not in social commission, really. There's puffiness, swelling, and some redness that we see very commonly with photodynamic therapy that we often don't see with IPL. So we tell people to plan on 3 days or so of downtime, maybe over a weekend with photodynamic therapy, obviously longer with fractional laser. So they are apples and oranges in a way, comparing fractional laser, photodynamic therapy. They work in completely different ways. Fractional laser is ablative, means it's actually injuring the skin cells themselves and stimulating remodeling. Photodynamic therapy, on the other hand, is using a photosensitizing agent to shrink the glands down and kill bacteria, and we still have that intense pulse of light, if you will, that can get rid of the sun-damaged pigment that is called melanin, as well as improve or reduce the vasculature, the redness or flushing that we see in the skin. So acne management is complicated. I hope I have provided a little bit of enlightenment in terms of the beginning options in skincare and then the more advanced options. There are certainly medical options that can't be ignored, like the use of antibiotics or certain other medications, and they're very important too. But in terms of the energy interventional therapies, fractional laser for scarring is an excellent choice. Photodynamic therapy for pore size and for bacteria count reduction are excellent choices, all laid on top of a good skincare program. A very tricky subject. Acne is a complex disease that has no magic wand that cures it all, but one that you can surely get great improvement on if you're connected with the right advice and the right technologies. This is Dr. Corey Maas on Looking Your Best. Please give me, if you have any other questions about acne, send them in to Dr. Maas at maasclinic.com. Visit our website at maasclinic.com, or you can call for a consultation at the Maas Clinic, 415-567-7000. This is Dr. Corey Maas on Looking Your Best. Thanks.